I originally injured my knees probably in my early 20s when I was at a younger brother's baseball game. And I was young and invincible, so I never sought treatment for it at that time. But now that I was almost 40 years old and trying to be more physically active, I was having a lot of knee pain and a lot of swelling. Felt like I was holding like a tennis ball behind my knee. And so I went to Dr. McKenna, who set me up for an MRI, and realized that I no longer had an ACL. So I work at the facility that I had the surgery done at, so I knew all the staff there.
Now we have the ability to use bone marrow instead of just PRP. We've created a harvest device that makes the harvest of bone marrow much safer, lowers the morbidity of the patient. There's not really a lot of complications associated with the bone marrow harvest anymore. Chad watched probably 6 months of surgery working with us here in the OR before he ever brought up to me the fact that he had an old knee injury without an ACL. And so he had actually watched several hundred surgeries with the use of bone marrow. And one day during an ACL became exquisitely inquisitive about why we're using bone marrow and the change in the healing and using allograft. And after the case, he asked me if he could get an appointment and come talk about his ACL. He had an ACL injury 10 years before.
So I came in for surgery, got prepped for surgery, went back to the OR. I had my ACL done. The repair took place. Went to recovery, had no pain. I had a block done, an anesthesia block done on my leg. So I had no pain for the first 2 days. And then even after that, the pain was very minimal. One of my favorite hobbies is to go bowling. And I was able to start bowling again 30 days after surgery. And I mean, I go 2-3 times a week and don't have any issues.
The difference between using a stem cell augmented orthopedic case is that Chad could be back at work within the first 2 weeks and could be back living his life within that first 4 to 6 weeks. And for Chad, that meant bowling, and it meant being on his feet in the OR for 10 to 12 hours at a time.
I never had to use physical therapy. Crutches were very short. It was a very fast recovery. I don't even really remember the pain at all. Dr. McKenna, I mean, he's a character. I mean, he's most important aspects of his job to him is to make sure that families and patients are very well educated. And I mean, he takes the time to talk to you as long as you need to talk to him. And I mean, he's great in the OR. I've been working with him for over 3 years now, and we've never had to bring his patients back. I mean, we don't have infection problems, we don't have the redo problems, so it's been great working with him.